Our bodies are incredible machines, constantly sending us signals and signs to communicate their needs and well-being. These signs can range from subtle hints to glaring red flags, and being attuned to them is crucial for maintaining good health. Ignoring certain body signs can lead to serious consequences, as they may indicate underlying health issues that require attention and intervention. In this video, we will explore some of the most important body signs that you should never overlook. So let's get started talking about 8 important body signs you shouldn't ignore. 1. Persistent headaches. Headaches are common, but when they become recurring and severe, they should raise concerns. These persistent headaches may signal various health issues, including tension-type headaches, migraines, or potentially more serious conditions. Tension-type headaches, characterized by a constant dull pain that wraps around the head, can be caused by factors such as stress, poor posture, or even a lack of sleep. On the other hand, migraines, which are typically pulsating and accompanied by nausea or sensitivity to light and sound, can significantly disrupt daily life. Both of these types of headaches can be managed with lifestyle changes, medications, or therapy. Persistent headaches could also serve as red flags for more severe conditions, such as intracranial hypertension or tumors. Intracranial hypertension, often associated with increased pressure within the skull, can cause persistent, throbbing headaches. If left untreated, it may lead to vision problems and other complications. While rare, brain tumors can manifest as recurrent headaches, often accompanied by other concerning symptoms such as seizures or changes in cognitive function. 2. Unexplained weight loss. Shedding pounds without a deliberate change in diet or exercise routine is a red flag that should not be ignored. While it's natural for body weight to fluctuate slightly, dropping more than 5% of your body weight within a few months is typically classified as unexplained weight loss and warrants medical attention. There are numerous potential causes for this phenomenon, ranging from benign to severe. One common reason is an overactive thyroid or hyperthyroidism, which can lead to an increased metabolism and unintentional weight loss. On the other hand, unexplained weight loss can also be an early sign of diabetes, as the body may lose excess sugar and calories through frequent urination. Digestive disorders such as celiac disease, Crohn's disease, or irritable bowel syndrome, IBS, can impair nutrient absorption, leading to unexplained weight loss despite a seemingly normal diet. Malignancies such as cancer are notorious for causing unintended weight loss, as the body's energy reserves are redirected to fuel the growth of abnormal cells. Other potential culprits include depression, eating disorders, or even certain medications, all of which can disrupt appetite or metabolism. 3. Constant fatigue. Tiredness is a normal part of life. However, unrelenting and severe fatigue that persists despite adequate rest can be a sign that something is amiss within your body. There are various potential causes for constant fatigue, ranging from lifestyle factors to underlying medical conditions. Poor sleep quality, insufficient sleep, or irregular sleep patterns can lead to persistent tiredness. Stress, anxiety, and depression can also contribute to a pervasive feeling of fatigue, often accompanied by mental and emotional exhaustion. Lifestyle factors such as a sedentary routine, an imbalanced diet, or excessive caffeine intake can sap your energy levels over time. It's essential to recognize that constant fatigue can also be a red flag for more serious medical conditions. Anemia, a condition characterized by a low red blood cell count, can result in fatigue due to reduced oxygen delivery to body tissues. Thyroid disorders like hypothyroidism can slow down metabolism and lead to persistent tiredness. Chronic infections such as mononucleosis or Lyme disease can trigger prolonged fatigue as the body fights off these illnesses. Even conditions like sleep apnea, which disrupts nighttime breathing and causes frequent awakenings, can lead to chronic fatigue. Autoimmune diseases like lupus and rheumatoid arthritis often accompany fatigue as a prominent symptom. Diabetes, particularly when uncontrolled, can result in ongoing exhaustion due to fluctuations in blood sugar levels. 4. Changes in urination. A person's urination habits typically follow a relatively consistent pattern, and deviations from this norm may signal potential concerns. Frequent urination, for example, can be attributed to a variety of factors, including excessive fluid intake, urinary tract infections, or conditions like diabetes or an overactive bladder. Conversely, infrequent urination may signify dehydration or obstructive issues within the urinary system. Blood in the urine, known as hematuria, should always be taken seriously, as it may be a sign of urinary tract infections, kidney stones, or even bladder or kidney cancer. Pain or discomfort during urination can be indicative of urinary tract infections, sexually transmitted diseases, or interstitial cystitis, a chronic bladder condition. Sudden and uncontrollable urges to urinate, known as urinary incontinence, could result from weakened pelvic muscles, neurological conditions, or hormonal imbalances. Changes in the color, odor, or consistency of urine might reflect variations in diet, hydration, or medication usage, but they can also signal underlying issues such as liver or kidney problems. 5. Shortness of breath. Shortness of breath can manifest gradually or suddenly and may be accompanied by other symptoms such as chest pain, cough, or wheezing. Common causes include asthma, chronic obstructive pulmonary disease, COPD, and respiratory infections. Asthma, a chronic lung condition, can lead to sudden episodes of breathlessness triggered by allergens or irritants. Chronic obstructive pulmonary disease, primarily caused by smoking, results in progressive lung damage and persistent shortness of breath, particularly during physical activity. Respiratory infections, such as pneumonia or bronchitis, can cause temporary breathlessness due to lung inflammation and reduced oxygen exchange. Shortness of breath can also indicate severe conditions like heart disease or pulmonary embolism. Heart disease may lead to heart failure, where the heart cannot pump blood efficiently, causing fluid buildup in the lungs and shortness of breath. Pulmonary embolism, a blockage in the lungs' blood vessels, can cause sudden, sharp chest pain accompanied by breathlessness and is a medical emergency. Shortness of breath can be a sign of an underlying issue even outside the respiratory and cardiovascular systems, such as anemia, anxiety disorders, or obesity. Anemia, characterized by a low red blood cell count, can reduce the oxygen-carrying capacity of the blood, resulting in breathlessness and fatigue. Anxiety disorders can cause hyperventilation and a sensation of breathlessness during panic attacks. Obesity, due to the added strain on the respiratory system and heart, often leads to chronic shortness of breath. 6. Chest pain. The causes of chest pain are diverse and can originate from both cardiac and non-cardiac sources. Cardiac-related chest pain, often described as a crushing or squeezing sensation in the chest, may signal angina or a heart attack. Angina occurs when there is reduced blood flow to the heart muscles, typically due to coronary artery disease. A heart attack, on the other hand, occurs when a coronary artery becomes completely blocked, leading to damage to the heart muscle. Both conditions require immediate medical attention, as prompt intervention can save lives. Chest pain is not always related to the heart. It can also result from gastrointestinal issues like acid reflux, where stomach acid irritates the esophagus, causing a burning sensation in the chest, which is often mistaken for cardiac pain. Chest pain can also stem from musculoskeletal problems, such as muscle strains or costochondritis, which is an inflammation of the cartilage connecting the ribs to the breastbone. Respiratory conditions like pneumonia or pleurisy may also manifest as chest discomfort, particularly during deep breathing or coughing. 7. Abdominal pain. Mild and temporary abdominal pain often results from indigestion, gas, or overeating and usually resolves without intervention. Persistent or severe abdominal pain can indicate more substantial underlying issues. Gastrointestinal problems, such as gastritis, ulcers, or irritable bowel syndrome, IBS, can manifest as recurring abdominal discomfort. These conditions can be managed through dietary modifications, medications, and lifestyle changes under medical guidance. In some cases, abdominal pain could signal more concerning conditions, such as appendicitis, gallstones, or even organ damage. Appendicitis, a medical emergency, typically presents with sudden, severe pain on the lower right side of the abdomen, often accompanied by fever and nausea. Similarly, gallstones can cause intense pain, typically located in the upper right abdomen, and may require surgical intervention. Abdominal pain can also be a symptom of serious conditions like Crohn's disease, diverticulitis, or ovarian cysts, which necessitate specialized medical care and diagnostic tests, such as imaging scans or blood tests, for accurate diagnosis. 8. Vision changes. A sudden blurriness or clouding of vision can signify issues such as cataracts. Cataracts are a condition characterized by the clouding of the eye's natural lens, which is common in older individuals but can occur at any age. Similarly, glaucoma, often referred to as the silent thief of sight, can progress stealthily, with symptoms initially going unnoticed. It gradually damages the optic nerve, resulting in peripheral vision loss and, if left untreated, eventual blindness. These conditions can often be managed effectively with early detection through routine eye exams and appropriate interventions like prescription eyewear, medications, or surgical procedures. Sudden severe vision changes accompanied by eye pain or redness can indicate more urgent problems, such as retinal detachment. Retinal detachment is a medical emergency that demands immediate attention to prevent permanent vision loss. On a broader scale, vision changes might also be linked to systemic health issues, such as diabetes. High blood sugar levels in diabetes can damage the blood vessels in the retina, leading to diabetic retinopathy and potential blindness if left untreated. Some autoimmune diseases, like multiple sclerosis, can cause visual disturbances due to inflammation of the optic nerve. Thank you for watching. We hope you found this information valuable and informative. Please remember that while we strive to provide accurate and up-to-date content, this video is not a substitute for professional medical advice. If you are experiencing any of the symptoms discussed in this video or have concerns about your health, please consult a healthcare professional for a proper evaluation. Your health and well-being are our top priority, so stay informed, take care of your body, and don't hesitate to seek medical guidance when needed. Be sure to like, share, and subscribe for more health-related content, and we look forward to seeing you in the next video.